Most individuals do not consider liver disease and liver cancer to be a complication of obesity, diabetes, or the metabolic syndrome, but they should. In an article that appeared in the February 15th issue of Family Practice News, Mitchell Zoller presented medical research over the past decade, which is showing that people who have underlying insulin resistance don't just gain fat around their middle, but also begin depositing significant amount of fat in their liver. This is referred to as non-alcoholic liver disease. This collection of fat within the liver can go on to cause more serious liver diseases like cirrhosis, non-alcoholic hepatitis, and actually liver cancer. In fact, Dr. Ronald Obesity is quoted in this article stating that this fatty liver is going to surpass hepatitis C as the leading cause for liver transplant in the next 10 to 20 years. Normally, there is no fat that collects in the liver. However, when you develop the metabolic syndrome, you begin gaining an unusual amount of weight around your middle. Researchers are now beginning to appreciate the fact that you also begin depositing an abnormal amount of fat in your liver. This fat does not allow the liver to function normally. Therefore, the liver can become inflamed, which is referred to as hepatitis, which can eventually lead to scarring and what we call cirrhosis. About 15% of these patients will develop cirrhosis of the liver, and a significant percentage also develop liver cancer. If the patient goes on to actually become diabetic, these numbers go up dramatically. Beginning to develop an expanding waist size is not just a cosmetic problem. Physicians have been referring to this type of weight gain as killer fat for years. This is because it is known to be associated with high blood pressure, high cholesterol and triglyceride levels, and places you at very high risk of having a heart attack or stroke. Now that we are beginning to appreciate the terrible effects it can have on your liver, physicians are going to become even more concerned. There are no approved drug treatments for this fatty liver disease. The standard of treatment is intensive lifestyle changes that actually improve insulin sensitivity and allow you to lose this central fat effectively and permanently. In fact, Dr. Kusi recently published a study that showed a 7 to 10% weight loss was associated with approximately a 50% drop in liver fat levels. This obviously improved liver function and decreased the risk of further liver damage.